And just to follow up, what does like assessment and therapeutic intervention actually mean?
Yeah, honestly, it's a great question. Sometimes I ask myself that, what on earth am I doing? So assessment, we basically give in schools, we basically give kids tests. They're really short. They're about 2 to 12 minutes each. We go through a lot of those tests, and the tests are of things like intelligence, like we do real IQ testing, and we also do academic testing, and we also do things even like social emotional and executive functioning and all those other skills that you need to be able to operate in the daily world and be able to do okay, or you know some sort of adaptive way that you can find your strengths and successes. With that, assessment historically is very medical model. We try to find out what's not going well, and then we provide some recommendations and ideas about how we can help. But you know what? The new wave of assessments way better. And I'm so happy I've been trained in this, where we sort of start with the question, like, what's going well? I genuinely think Chris Bowers has got it right. You start with what's going well, and then you build from there. Now, assessments can result in things like diagnoses. In schools, we often assess for learning disabilities, intellectual disabilities, things like anxiety, depression, not so commonly from a school psychologist, but someone who would be in private practice or a community mental health clinic. And then therapeutic intervention, that's kind of like what you see on TV. You got the couch, you got the therapist in the chair, they ask questions. Now, what therapy actually looks like these days depends on your theoretical orientation. I'm an ecological behaviorist. That means that by and large, I believe that kids live in the world that we put them into. We can do a lot more to make the world better for them if we think strategically, if we're a little more creative in the world we put them into. So we as adults can come up with strategies to help, so we're not putting the blame or the focus on the child. Well, the focus, but not the blame. That means that in therapy, I really do a lot of problem solving with parents, and with kids themselves, also giving them some strategies and tools they can use to mitigate things like anxiety, depression, even some externalizing stuff. So like when they really act out, literally flip desks, I'm there to help too. So kind of the crisis response all the way through the, I'm hearing life is hard. Tell me more about that. And sometimes just feeling identification, thoughts, and linking that with how your feelings and thoughts change the way that you operate in the world, your behaviors. That's cognitive behavioral therapy. Psychologists do a lot of that.